Hi, Matthew Holt, another TCB Quick Bite. This is Danielle Vaeth. She is the head of growth at a company called Qbtech. Did I get the name right?
You did.
Fantastic. Which is a Swedish company which has built what exactly, Danielle?
So we have a digital diagnostic tool for screening, assessing, and monitoring kids and adults with ADHD that uses Google facial recognition technology to monitor symptoms objectively. Gives out this beautiful, highly visual report for clinicians to use to better improve their conversations and accuracy with their patients.
Okay, so it's diagnostics, right? Initial diagnostics?
Initial, yeah.
So how does somebody get to it? What are the major channels that you're using?
Sure, so it's a B2B environment where we're selling to clinicians directly, whether that's a pediatrician or a nurse practitioner, health system, virtual care provider.
All right, and most of it is done in the office, at home, where, with whom?
Yeah, so I would say that most of our patients are actually being seen in the remote environment.
Okay, so what are some of the names of the remote providers who might be using this that I might have heard of?
So Medical University of South Carolina is one in their developmental pediatric department. We've got University of Florida, some of the adult practitioners or psychiatrists there. We're in neurology, different university settings. Some networks like LifeStance, for instance, utilizes us. Yeah, okay. And then some virtual care.
Okay, so they're using you in the in-practice session or for both virtual care both, or are there? Let me ask you a slightly related question here, Danielle, which is how much of this type of diagnostic and then tracking as it goes on through treatment is being done by the large virtual providers that we've all heard of that are raised $1 gazillion?
It's a small group. There's an uncertainty with the DEA and what they will do with Schedule 2. So ADHD was an item in the news, I guess.
Yes, it has been.
And so there's been a question mark of, can we add this to our business model, and is it going to be sustainable? So that will be to be determined. I think we'll hear something soon.
Why is it? I mean, I guess other than they might, take away the right to prescribe the drugs, which are a big part of ADHD, and telehealth. Well, to me, I think that is relatively safe. So we'll see. But I mean,
I do too.
Is there a bigger problem with not wanting to know the answer?
Well, I think clinicians do want to know the answer. Not everyone wants to treat it. I think that being able to have clinicians who are comfortable with treating ADHD have this technology in their hands is the advantage to those virtual care providers, so that not every patient, right? We're able to really customize who the providers are matched with from the patient perspective.
Okay, and in that part, how much of, to talk about the matching issue, right?
Yeah.
So we have the issue of what has somebody got, how far on the scale. The next one is who should be treating them. Is there a big problem in the wrong people being treated by the wrong type of therapist, and presumably also the wrong type of pill or wrong type of medication?
Yeah, no, that's a great question. So I think when we think about who can prescribe, people that are licensed to prescribe and are able to do so. But there's 15 million adults, the CDC just said, have ADHD. 60% were diagnosed as adults. But there's not adult guidelines. So getting a tool that can actually help to look at symptom severity and then are we responding or not to our treatment. Patients are terrible self-reporters. Our data shows that we can identify 50% more of patients responding to treatment than by self-report alone. So I think there's just that's probably the advantage for providers who are able to do that in prescribing.
So two final questions.
Yeah.
First is, what are you actually recording in the facial record? What are you picking up that's telling you whether what the diagnosis is right, and B, the treatment is working?
Yeah, that's great. So basically, the facial recognition technology grabs the face.
I will be running this obviously through facial
Yeah, you should do it. You should do it.
To figure out how you're doing with your own
all
ADHD.
Over the place. Yeah. But right when we fidget, so females will move a lot less usually than males, and so it's picking up all of those micro movements, the time active, the distance that we move, those types of micro events, and they will change over time when you're understimulated. And so if you have ADHD, you're understimulated and you are hyperactive, you're going to start to move more. But it's subtle and it's really hard to pick up just in a virtual visit.
And what is the scientific background for that? What you do being correct How do I know you're right? How do you know that Qbtech is correct rather than just making crap up?
Yeah, that's a great question. So we just got a nice appraisal, or a nice approval, I should say, which is really exciting, and that looked at health
By
economics.
nice, you mean the British nice,
Yes.
not just a
Just not
nice thing.
nice to have. Yep. No. That came from a pretty long study within the NHS system, and then we also have 43 peer-reviewed studies that look at our sensitivity and specificity, and that's what the FDA also looked at.
All right, so it's got an
So it's
FDA approval for
Screening
ADHD.
and then for treatment monitoring.
And last thing, so you're a Swedish company. Tell me a bit about the size of the company, where this is deployed around the world.
Sure.
How much money you raised, how wealthy you're all going to be. Give me the lowdown.
Oh my
on the
gosh,
company.
this is ADHD. So we're Series A. We got that in 2022.
How much did you raise?
I don't remember. I'd have to look. I know I should know, but that's
5
not my job.
million, 20
It's not my
million,
job. I don't
500
know.
million. We don't know.
I don't
Any
know.
number.
We don't
I
know.
will find out.
We will Matthew will figure it out, and he will report back. Those who need to know must know. We're 100 people globally, and that's split between U.S., Europe, Sweden, and London.
And where are most of the current customers? In Europe?
No, this is an internal race, so challenge to my team here.
We'll find out.
We're probably 60% US, 40%
Okay,
Europe.
distributed. And then how many people have been through the system or are currently using the system in the US?
Oh, thanks for asking. So we just hit our millionth patient that's been tested, which is really exciting for us.
Not bad. So a million, you think there are 15 to 20 million adults with ADHD, God knows how many kids. Most of it. I live in Marin County where every kid has ADHD, including mine. So well done. 1 million down, only a gazillion million more to go. All right, Mr. Danielle Vaeth. She is the head of growth in the US for Qbtech. Danielle, thanks for your time.